Hello and welcome to Close Calls with California Poison Control System. I'm Dr. Ray Svora, Medical Director at the Fresno Madera Division of our Poison Control System. I'm joined today by Dr. Cyrus Rangan, a pediatrician and toxicologist based in Los Angeles and also affiliated with California Poison Control, and Stephen Weiner with the Food and Drug Administration, the FDA, where he serves as a health communications specialist. Welcome, Stephen and Cyrus. Thank you so much for joining us. For National Poison Prevention Week, we really try to raise awareness about the dangers of accidental poisonings and how to keep people safe, especially from hazards that they may actually have around their household or in their workplace. And I can't think of one that's more relevant than acetaminophen, which is the topic that we're going to talk about today. So I'll start with you, Cyrus. Why exactly is acetaminophen such a concern? And how common is this overdose in terms of the calls that poison control receives?
Well, acetaminophen is one of the most commonly used medications worldwide, and we give it for all kinds of ailments that include coughs and colds and fevers and pain, and it's present in so many different products. So people are taking it every day. It's ubiquitous. It's in many people's homes, almost all people's homes, and in their purses and in their workplaces. So because the medication is so ubiquitous, we need to be very conscientious about the potential toxicities that it may cause if it's used inappropriately.
Thank you. And what are some of the signs and symptoms of the toxicity? How would somebody know if they're taking too much?
It can be very difficult to know at first because many patients in the first 24 hours or so after taking too much acetaminophen may have no symptoms at all, even though they may be carrying a toxic dose of acetaminophen on board. When those symptoms do begin, however, they may begin with things like nausea, vomiting, abdominal discomfort, and that may progress to more severe symptoms such as toxicity to the liver that may cause liver failure. But those early symptoms can be very similar to some of the symptoms that you may already have from the virus or whatever it is that may be causing you to take acetaminophen in the first place. So that's why it's so important to be very conscientious about dosing, when we're giving it, how much we're giving it to ourselves or to our children.
Thank you. Let's switch gears and discuss some of the safety efforts that the FDA has been undertaking to keep people safe from acetaminophen. Stephen, we know that this is something that you're dedicated to and spend a lot of time doing. What are some things that people need to know about acetaminophen safety, especially in light of some of the shortages and things like that we've heard about as a result of the viral pandemics that we've undergone?
Thank you. Yeah, so being a health communication specialist here at the FDA, this is part of my job, is to get this information out to the public. And we have so many educational materials on our website that, I'd like to point out. Even if you just go to FDA and put acetaminophen, you'll see some YouTube videos and consumer information, fact sheets and things like that that can actually help and educate the public. And if you're a clinician, it'll help your patients. I think it's something to think about because I don't know if you know this, but there's over 600 medications, both over the counter and prescription, that contain acetaminophen. So as you can imagine, we all probably have these laying around our house, whether we've gotten them from the doctor in the past, or we have the more common things over the counter. And some of the more common forms of this are Tylenol and Panadol. But so I think I'll leave it at that right now. But, we've all got these in our homes. It's pretty likely. And so it is something, when taken in the correct dose, it's incredibly effective. But taking too much can cause severe issues. And we'll talk about that a little more. But the main thing is to protect your liver.
Thank you. Cyrus, let's walk everyone through what poison control does every day. Suppose someone calls our hotline and they have gotten into a toxic dose of acetaminophen. What can they expect to hear from the staff on our poison control hotline? Or if they go into the emergency department, what is that going to look like?
Sure. Well, whether you're calling from home or whether you are a clinician in the medical setting, you can always call us at Poison Control 24/7, 365, and we'll be able to talk through the situation with you. We'll ask you appropriate questions and pertinent issues about what's actually happening with that particular exposure, and we'll be able to help you decide so you don't have to guess as to whether or not you need to go to the emergency department or whether this is a situation that we can help you take care of at home. Calling Poison Control means that we will be able to help you make that decision so you don't have to make it for yourself.
It sounds like when people go to the emergency department, one of the first things that we do if we suspect acetaminophen poisoning is get a level, an acetaminophen blood level. because that really helps us point to, what needs to be done next. If the level is really high, they're going to require getting, aggressive therapy, especially getting the antidote for acetaminophen poisoning. Can you share what that process is like?
Sure. One thing that we always say to our clinical providers is anytime you ever have a situation where a patient comes in with an intentional or suicidal or otherwise similar kind of overdose, always get an acetaminophen level in those patients, even if they don't have any recollection that they may have taken it, because screening for that acetaminophen level means you may find cases that otherwise may have gone unnoticed or undiagnosed. Or, of course, if there is a history that the acetaminophen was actually ingested, then, of course, we get our level of acetaminophen. And based on that level, we can use that level that we detect in your blood to determine whether or not you actually need the antidote for acetaminophen. And if you need antidotal therapy, there's ways that we give that in the hospital setting, and that we make sure that you get over that case of toxicity. The vast majority of people who get to the hospital and get there on time and get good care will do very well with treatment for acetaminophen overdose.
Yeah, and that is such good news that we do have an effective treatment for it. It does require you to be, in the emergency department and hospitalized, but fortunately, we're able to help a lot of people with either accidental or intentional acetaminophen poisoning. Let's switch gears and talk about some good prevention and safety tips. What does everybody need to know, whether they're a patient, a parent, or a clinician, about acetaminophen toxicity? We'll start with you, Stephen.
Yeah, thanks again. I think in general, when taking medications, it's important to follow some basic guidelines every time you're taking a particular medication. For this one in particular, you want to make sure you're following the dosage instructions. And this can be different, whether you're an adult, you're under 18, you're under 6, or a child. So make sure you're following the dosage instructions closely. Another good safety tip is to make sure you're not taking more than one. You don't want to be taking more than one over-the-counter product, and you don't want to be taking a prescription product and an over-the-counter product. So just make sure you're only taking one product that contains acetaminophen. And then I'd also, just like to mention for this one in particular, because it affects your liver, don't be drinking alcohol or too much of it anyway. Don't drink too much, or have a conversation with a physician and figure out what the proper amount of alcohol you consume is if you have to, but probably not a good idea when we talk about acetaminophen. And then if you're experiencing any sort of reaction, swelling, numbness, things like that, your face blows up, again, it's kind of common sense, but at the same time, pay attention to that. And as, we talk about this acetaminophen, in case you overdose, sometimes you might not even know for a couple of days. It could be something that's very, very minor. You could just have cold or flu symptoms, but that is actually an overdose happening. And if you continue taking the product, it can actually make it worse. So the last thing I'll mention is that if you do have an adverse reaction, always check out the FDA MedWatch page, and please report that to us. Thanks.
Great. Yeah. Thank you for mentioning the MedWatch program. That's one of the close collaborations between poison control and our partners at the FDA. And we really appreciate you coming on to our Close Call series and sharing these safety tips. Any last minute thoughts from you, Cyrus, about acetaminophen toxicity or poison control in general?
Sure. Just one note about children and acetaminophen. One issue that we do run into, especially with calls that come to our center, are parents who are giving acetaminophen for treating the child's fever, and then also giving, as Stephen mentioned, another product. So that product may be a combination product that contains acetaminophen, but that medication is for the cold that the child is having. And many parents may not simply be aware that acetaminophen is actually in that combination product. So it's very important to regard what's on the box and try to look for that name, acetaminophen, and make sure that you're not doubling up on those doses. And that's one way that we can help prevent these kinds of exposures from happening.
Great advice. Thank you both so much. In poison control, we always like to say too much of anything can be toxic, and acetaminophen certainly follows that rule. We hope that you've been able to get some great information during this brief video. We have lots more information on our hotline, so feel free to call us for any poison-related questions or help. And please join us again. Thank you, Dr. Cyrus Rangan and Stephen Weiner, on this episode of Close Calls with acetaminophen.